filled and happy. And I hope you'll have impactful and edifying conversations today. We have very great guests. I saw from the profile, we have great guests today, and I cannot wait to have a beautiful conversation with them today. All right, I'll just start with a bit of my stories before we go on. Well, as I said, my name is Yvonne Kihumba, and back in 2014, I was diagnosed with anxiety and depression. And it was quite a tough time for me because first of all, I had never had of such a thing, and I have been always a person who is maybe the strong one in the family, the firstborn, and all that. And so for me, it was very, very difficult, even in the work spaces, because I was in Form 4 back then. And the teachers, because I was a top performer, the teachers were thinking, you should repeat, maybe so that I can represent the school very well. But I still did, and I still went to do architecture. And still in architecture, it was such a tough place because I used to take breaks in between school. I did not only get mental illness, but a neurological problem because I also had a neurologist and a psychiatrist at the same time. And it was quite difficult even after I graduated from architecture school, finding a job and still having seizures in the construction site. So later on, because of the discrimination and stigma, I just decided not to be a victim of my circumstances. And one time I did a piece of art represented to one of the people we know well in Kenya. He's not a politician, but he's a very great and renowned person. And he said, he just saw the art piece me raising, and he said, that is what we call not being a victim. And I loved the fact that he saw that I am not calling myself a mentally ill person. So within that period, I took medication from 2014 to 2019, that is 5 years. I took really heavy medication, which played around with my body, my weight, my skin. And then in 2020, I decided, let me take therapy seriously. And I did talk therapy, and I did life coaching, which helped me greatly. Then finally, I was good. When I just started doing therapy, that's when I stopped taking medication. And we came to realize there are some traumas I experienced as a child. Like I was sexually assaulted as a child, I kept it to myself. We had family issues, and I kept it to myself. So now I know, and I'm spreading awareness. How can you know your child is safe and they're hiding something? How can we teach children so that they cannot be assaulted in school? What are the symptoms of mental illnesses that we can be able to find within the youth and our children? So I am very passionate about this topic, and that is why I started Jasiri Warriors. And I'm so glad to be here today. Maybe I can introduce the guests for you so that we can go forward. Even as we ask them questions, we can be able to know their names. We have Dr. Stacey Njani, who's the Deputy Chief Resident at the University of Nairobi. She is a resident psychiatrist at Mathare Teaching and Referral Hospital and Tranquil Medical Center. That's fantastic, Stacey. Thank you so much for being here with us. And I have had friends who have been at Mathare, so that's very good to know that you have been part of that. Stella Wariongi, she is the head of mental health and substance use program at Nairobi County Directorate of Health. Thank you so much, Stella, for joining us today. Then our guest, Rutere Casimir Njeru. Maybe you can tell me whether I pronounce your name correctly. He is a certified counselor, a mental health advocate, practitioner, scout for healing invisible words. Yeah, I've seen that on social media. That's beautiful. Yvonne Amolo, she is a psychologist, and Nairobi Place Addiction Treatment Center. That's where she is. And I saw her talking about better living. Funny thing is that the Siri Warriors have adopted a children's home called Better Living in Zimmerman. So maybe you could partner in that. And then we have Tony Kisaka, Head of Strategy and member partnerships at Coalition Action for Preventive Mental Health Kenya, strategic advisor at RESO 247. So thank you so much for joining in today. Even maybe as I ask them questions, I still would want to know more about them. In case you have questions, you can put on the chat box as we continue on with our conversation. Let it feel like a conversation than us presenting to you or talking to you, because mental health is such a big and major issue in Kenya right now. We've heard of suicidal cases. Just last week, but one, I was at Risambu and there was a suicide case over there. We've heard of a lot of mental illness cases in Kenya right now. So this is a topic we cannot avoid, and we have to keep the conversation going until the stigma ends and until the rate of suicide cases and illnesses go down. Yeah, so karibuni sana. We'll start with Yvonne Amolo. Yvonne Amolo, I hope you are there.
Yes, I am. I'm not sure if I'm audible enough. Am I?
Yes, we can hear you, Yvonne. I'm glad to talk to my namesake. So Yvonne, first of all, maybe you can tell us what you do before I go ahead and ask the question.
Okay, hello everyone. My name is Yvonne Amolo. I'm a psychologist by profession. In that aspect, I'm trying to mean that I am a mental health practitioner by profession. Currently, I am working at Nairobi Place Addiction Treatment Center. Other than that, I'm also a youth by at heart and also by age. And I also partner with other organizations to try and create awareness on mental health. Yes, so it's an honor to be here today. And as mentioned briefly, I'm also part of Psychology for Better Living Society. This was a society formed by the young people in the aim of trying to bring professionals together so that at least we can be able to sharpen each other, create awareness. Other than that, I'm also seeing a familiar face, Kasmir. I'm not sure if you can remember me, but it's a pleasure to see you here today. I also partner with with Scouts for Healing, Scouts Healing Invisible Wounds. I'm sorry, in one or two events here and there, and many other organizations. So I hope that is enough introduction. Yvonne, kindly direct me on the way forward from here.
Right. Thank you so much. That was very beautifully done, Yvonne. Even as we talk about the mental health crisis, I would like to ask you, what strategies do you think can be adopted to reduce stigma around mental health in Africa?
Thank you very much. And being the first speaker, I might say, or whoever, I think I can give a brief history on what mental health crisis looks right now in Africa. We're having a lot of challenges as Africa. And if you read a bit wider, you will notice that Africa is the youngest continent. That is how they call it, meaning that the young population and adolescents form a very big, large number of population. And these adolescents and youths, I included, and some of us, as I can see here, have a few issues that we're struggling with, including things like food security. It is not everyone who can afford to be able to get food on a daily basis. So there's always instant or excess worry on where am I going to get my next meal, especially in this kind of economy right now. We also have issues to do with education. It is not easy to get educated, especially in Kenya, especially in higher education levels. You find that there's always worry between education or meeting my needs. And other than that, there's a lot of chronic poverty in many countries, as we know. And this is affecting us. We might think that it's a social problem, but it's also leading to issues like anxiety issues, excess worry about tomorrow, about food, about what. And also some of the youths and some of us maybe, we've also experienced things like abuse at a personal level, or we've seen other people experience abuse, which could be physical, it could be emotional, it could be psychological, and most cases it's very downplayed, or people don't think that it is affecting us, but it really does affect us. And some of us also exposed to even violence. Either it could be domestic violence, which is something that even international organizations are trying to bring a stop to. It might be normalized and in some places or seen as not a big issue, but it is something that affects us as we are growing up. That is why you find some children growing up with some conditions and some mental health issues that maybe could have been avoided if they had a protected childhood, and the list can go on and on. So the crisis is large, and as we know, Kenya is one among the countries leading with mental health issues. Statistically speaking, about 1.9 million Kenyans have a condition or the other. And also to look at it, other than that, it is not many of our institutions that are well equipped with the mental health facilities. Only 15 counties are equipped with mental health departments or psychiatric units in Kenya out of the 47 counties. So we still are behind in terms of even trying to provide these facilities. Other than that, we're also having an issue with enough human resource because you find that the workload and the people who need these services is way too much. And you find that, for example, in the universities, it is hosting or it is a home for thousands of students, but you might find that there's only one psychologist. I've not heard of a situation where there's a psychiatrist on board, but there's only one psychologist and they're supposed to attend to all the students, which is quite impossible or very straining. So the crisis is there, and especially for young countries like Kenya, it's a struggle we're having. So what can we do? And the stigma is also there at a large degree. So what do we do as a nation, as a continent that is really affected by this? So the biggest tool that works so far in my own experience and in my own interactions is creating awareness. It is something we need to do. We need to create a lot of awareness. This is done through webinars, talks like this ones that you're giving opportunity for such talks, conferences, even in churches. Okay, there's pastoral counseling as well, but we can also create awareness so that they can also know when to refer uh, a member when the situation is bigger than them. So we need to create more awareness on this so that we can have a situation whereby we can be able to tell the signs before it gets too late. We can be able to tell when things are not working okay in ourselves and also get necessary help. Other than that, I think we can also create proper linkages between this institution. You find that sometimes there is no proper way to access these facilities. They might be there, but it is not easy to access them. So maybe someone can feel that this is not a common problem. Maybe this problem I'm having is not really common out there. But if maybe we had more institutions that are set up, and if we had more dockets in that aspect, we might also show that this is something that needs attention. This is something that should be addressed. The same way that we say that some conditions have been declared a disaster or something, we also need to put something in that aspect of maybe declaring that mental health issues is becoming a concern, which in the real sense it's becoming a global concern. And also, other than that, as mental health practitioners, we need to be accessible. For that is for us who are mental health practitioners, and also for those of us who are advocates. We need to be accessible. I was discussing this with one of my colleagues, and we noticed that we are in our offices, and the people mostly who need us are either in the rural areas areas or in other places. So how can we be accessible, and how can we now be able to reach to them? Maybe if we now had an alliance between community-based institutions and the elders, the chiefs, and all these other people, we can be able to reach a good number of people, because many people in the rural areas don't know, understand some of these conditions. If I go and mention depression in maybe a remote area in the Maasai area, they won't understand what that is. Maybe they've seen it, but they are going to say that this person maybe is possessed, or they are overreacting, or they're blah blah blah. There's so many things that we'll get in return. So we need to also try to access these areas, and also try to create to share information out there, because sometimes some of these stigmas that we are getting is not because they know and they don't understand. It's because they don't know what it really is. And we know what happens to us human beings when we see something we don't understand. We definitely fear it. It's an automatic response. So if we can be able to access these people, create this awareness, maybe we can have more people showing up and talking about this. And I'm actually appreciating you, Yvonne, for coming up and sharing your story. It is very inspiring and encouraging, because women who are struggling out here, but they won't mention. And maybe
Thank
there's some of maybe from hearing other stories, we can be encouraged to also share our own stories. And something that I've also seen that works with ending stigma is trainings. We cannot all be mental health practitioners, yes, but we can offer psychosocial support. Psychosocial support can be offered by anyone. And some of the trainings that are being held nowadays are in that line to help us offer psychosocial support. We might think that mental health issues are only addressed by mental health practitioners, but I promise you that mental health issues are also addressed by us from a common level, in the sense of you offering psychosocial support, where your friend comes and tells you, I'm not feeling well, I'm feeling down, I'm feeling what. And from there, you're going to tell them, encourage yourself, do this and this. That is psychosocial support. So maybe if we can also be able to partner as from the lowest point to the now the complex institution, that can also help us end the stigma. Thank you.
All right. Thank you so much, Yvonne Amolo, for that answer, and also for giving us an introduction on mental health crisis, the definition of that. All right. We have our keynote speaker, Dr. Brenda Obondo. We are so glad to have you here. Please, could you give us your keynote address or your keynote speech and tell us a bit about yourself?
Good morning,
Dr.
everyone. Yes, I'm here.
Oh,
Sorry,
fantastic.
I'm trying to fix my screen so that you guys can see me.
No problem. No
Give me a
problem.
minute. Okay.
All right. Feel free to write your questions on the chat box to introduce yourself. I can see Chi Emmanuel has introduced himself. Thank you very much. Yeah. Irene Othiambo, thank you very much for engaging on the chat box. Josephine Chan, thank you so much. Saud Elmi, we really appreciate you. Feel free to network on the chat box and ask questions regarding what Yvonne has talked about, Yvonne Amolo. And if you have any questions to Dr. Brenda, feel free to do that. All right, Dr. Brenda, you can take us away.
So I'm not able to have my camera on. I'm having a bit of a challenge with that, but I think I'll just proceed.
Yeah, it's okay. We can still
Yes.
see your beautiful face on the screen. So no worries at all. No worries at all.
Thank you. Good morning, everyone. It's really exciting to be in the presence of youth advocates. The energy is palpable, even online, and infectious. I'll draw from that energy. I am Dr. Brenda Obondo, as you have heard, and I'm the Chief Executive Officer of the Kenya Medical Association. Yesterday, we had a brief presentation on what we do at the association by Dr. Bosibori. But for the sake of those who were not able to log in early yesterday, the Kenya Medical Association is the umbrella professional association for doctors in Kenya. And it was founded in 1968 with a twin mandate. So what we do at the association, we champion for the welfare of doctors, and we also advocate for quality healthcare in the country and beyond. We do a lot of work in advocacy, and that's one of the reasons why Kenya Medical Association decided to partner with the Youth Initiative Development Program for this convention in the area of health and the youth. I'm honored to be here today on behalf of KMA at this pivotal Youth Initiative Development Program convention on promoting youth sexual and reproductive health, as well as their mental health. Our gathering here signifies a collective commitment to safeguarding the well-being of our nation's most vital resource, and that's our youth. In this era of rapid change and progress, we find ourselves at the crossroads of both immense challenges and unprecedented opportunities. The physical and emotional well-being of our youth is paramount to the advancement of our society, and addressing the intertwined issues of sexual and reproductive health, along with mental health, is a central obligation we all share. In Kenya, as in many other countries, adolescents face barriers that hinder their access to essential sexual and reproductive health services. There is stigma, we have inadequate education, we have limited resources, as is in the global south, as they say, and cultural taboos often stand in our way. And as a result of that, we witness preventable health issues, unintended pregnancies, unsafe abortions, and the spread of sexually transmitted infections among our youth. As a healthcare worker who has been engaging with the youth very closely, I can tell you for sure that most of the time we expect young people and adolescents to be the most healthy. But a lot of the times we find that they are ignored and their specific needs are not met within our healthcare system. Adolescence is a period of profound transformation, and it's a journey that takes us from childhood to adulthood, and it's marked by physical, emotional, and psychological changes. So these immense changes impact how we develop as young adults. However, it is also a phase often marred by the emergence of mental health issues. The statistics are sobering. I was looking at the Kenya Adolescent Mental Health Survey of 2023, where about 45% of adults displayed one mental health, adolescents, displayed one mental health problem or the other. And here we are talking about anxiety, depression, and other mood disorders that are on the rise among our youth. The pressures of academic performance, societal expectations, and the evolving digital landscape are also taking a toll on our mental health and well-being. In some cases, these challenges lead to devastating outcomes, including self-harm and suicide. Equally crucial in our pursuit of holistic well-being is addressing the mental health of our youth. Breaking the stigma surrounding mental health is a collective responsibility, and we must create safe spaces for our youth to openly discuss their emotional struggles and seek help without the fear of judgment. Moreover, integrating mental health education into schools and communities can provide young people with emotional resilience, and we can empower our youth to overcome challenges and lead more fulfilling lives. It is important to establish accessible and reliable platforms for health information. And allow me to say and emphasize reliable, credible health information on both sexual education and mental health. Because out there and with social media, we have all manner of advice, unsolicited advice from the public who become or confer themselves with, the training of healthcare practitioners. So we need to establish these accessible platforms where our youth can get this information that transcends social norms and taboos. Open dialogue and age-appropriate information are essential to empower our youth to make informed decisions about their bodies, their relationships, their habits, and eventually their future. When discussing young health, the question of access cannot be underestimated or overlooked. When we as a nation invest in youth-friendly health services, accessible counseling, and have community engagement programs, we should not just look at it as merely expenditure, because it's an investment in a future defined by healthier individuals. We'll have stronger families and a thriving nation. Moreover, we need to prioritize the elimination of financial barriers. Access and finance go hand in hand. And I'd like to applaud what our government is doing with the National Health Insurance Fund and try to make it all inclusive so that everyone can access this healthcare in line with our universal health coverage. So adolescents should have access to affordable or free services, including contraceptives and STI testing. Empowering our youth with the means to take control of their sexual and reproductive health contributes not only to their well-being, but also to the broader societal goal of economic development. True change is not imposed from above. It grows from within. And therefore, community engagement is a critical aspect of ensuring access to sexual and reproductive health and mental health services for the youth. We must increase our capacity as advocates and engage local leaders, parents, and peer educators to promote awareness, dispel myths, and create an environment of trust. And also for the sake of policy advocacy and advocating for policies that favor the youth in health. Empowering the youth also involves acknowledging and respecting their agency. By actively involving them in decision-making processes, we foster a sense of ownership over their health and well-being. A question I'd ask all of us is, are we empowered to be able to handle policy advocacy in areas that affect us? It is impressive to see the number of youth-led organizations that are driving this convention and other impactful initiatives. I'd like to say kudos to all of you. So ladies and gentlemen, addressing adolescent youth sexual and reproductive health, as well as mental health, needs a holistic approach. It is a tapestry woven with threads of knowledge, empathy, access, and support. To truly uplift our youth, we must collaborate across sectors. And I'm glad that we are having this discussion of public-private partnerships. From education to healthcare, from families to policymakers, we have to create an ecosystem that nurtures both the mind and the body. In conclusion, let us embark on this journey with a shared vision. A nation where every young person is equipped with the knowledge and resources they need to make informed choices about their sexual and reproductive health, and where every young mind is nurtured and supported to reach its full potential. Because by nurturing and empowerment, we unlock the doors to a brighter future for our youth and for Kenya as a whole. Thank you, and I hope we continue to engage and gain great insights in these areas of health among the youth. And I wish you all a lovely day ahead.
Thank you so much for that keynote address, Dr. Brenda. Thank you for still showing up, even though there were technicalities for us to see you. We really appreciate that you still showed up, and we appreciate that you're advocating for mental health, speaking up against stigma, and rolling on the conversation of mental health. And thank you also for appreciating and recognizing those people who talk about mental health over here. We really do appreciate you. Have a lovely day as well, and thank you for being part of us today. All right, I can see there are so many things going on in the chat.
Just interrupt, Stella Warungi is in. Thank you.
All right, fantastic. Thank you so much, Stella, for joining us in. And we are going to give you a chance in just a moment so that we can ask you some questions and you can tell us a bit about yourself. Even as you prepare, let me just go on the chat. I can see Andrew Aruko. Yes, we can see what you have written over there. We will connect. Thank you so much, Josephine, for engaging. And myriad, I don't know whether I pronounced it correctly. Okay, we can see you. We can see over there. All right, so let's remember to keep the house rules even as we continue. Stella, thank you so much for joining in. We would like you to tell us a bit about yourself, and this is the question that we would like to ask you today. What are the successful models of private and public collaboration in mental health which exist in other parts of the world? And how can African countries adopt and implement these practices to address mental health challenges in Africa? I have seen and I have had friends from the UK where the government is really supporting them even as they are mentally ill. And we have insurances in some parts of the country. And some have even free consultations or free therapy in other countries. For example, I've had in some parts of Canada. So how can we even implement this in Kenya? Thank you so much, Stella, for joining us. You can take it away from now.
Thank you so much. I'll switch on my video a bit as I introduce myself. My name is Stella Warenge. I work for Nairobi County, where I head the mental health unit. And my background, I'm a health psychologist and a public mental health specialist. What I do is that I basically coordinate the mental health services and structures within the city, where I bring partners together, make sure that the service delivery, ensure that we have commodities and all that, and also give the technical advice to the county management team. So coming to your questions about the models, I think when you look into other developed countries, you will find that is a replica in terms of the more the developed the country is in terms of even its per capita earning or even the health system, the better the services, even in terms of the general health services. So when you look at other models that are existing, it is deeply rooted into the health services, because even as we talk about mental health, it cannot happen in a silo. So when you look at other, like for example, even South Africa, you find that they have the funding from partners and also government recognizing giving mental health the recognition and the space and even funding. So you realize that for us as a country, we really need to start, even as we talk about mental health advocacy, it is all about the health structures. How good, because the mental health services will be as good as the health services are. So what can we borrow? I think it comes from, in terms of funding, are we having funding that is reinforced for mental health? And you have countries, you talked about like the UK, where the mental health is funded like 2% of the general health budget. And when you have countries like the UK that has the cities, like for example, one of my colleagues is a mental health lead in one of the cities, and they have a specific funding for mental health for that city that is a fraction of the whole health budget. So, and even partners will only come also when they see the government is funding, they'll also come in and give it attention. So I think we need to borrow in terms of the government funding it. What are the other private organizations doing it? Like in Nairobi, I have several partners, and you find that even the partners now that I have in the technical working group, very few are primarily having mental health as their domain. It is now after COVID that they are now starting to say, yeah, I think we need to include mental health as a theme. Maybe they're doing HIV, they realize mental health is a very key thing. They're doing youth reproductive health, and then they realize even as we improve, we talk about SRH among the adolescent and young people, mental health is a big driver. So it's about the organization giving funding for mental health. It's about the private companies, even as they do the social responsibility. What is it? Is it talking to about mental health? So I think we are somewhere, I would say, for the last 5 years, especially after COVID, we have seen a big paradigm shift where now even counties among our 47 counties, there's mental health coordination, there's mental health work plan, the mental health has given as a unit. So we are making the steps. Organizations are also having conversation, even having mental health month. So when it comes to the young people, we really need to be now it's a different thing, because we need to provide services for them that are responsive to their need. Even our counseling rooms need to be responsive. So they don't come into a room where it doesn't look nice. They want to feel, because that is where they are in their stages of life. So it's about us being the same way we talked about youth-friendly centers. Are we integrating mental health in these youth-friendly centers? Are we making mental health for them fun? Because for me, I say mental health can be fun. I can have a mental health conversation with you, but I can have it in a fun way, not to stress you down just to think about depression, drug abuse, but how can I drive that message to this young person? So when you look at partnership, we need to have partnership from the different sectors. The HIV, integrating mental health in their space and making it a routine kind of screening and conversation, reproductive health, SGBV. So I think for me, we can borrow different models coming from financing, community mental health, and even at the corporate level, they're there, and also borrow how is funding happening and how are corporates coming in and chipping in the mental health. Thank you so much, Anna.
Thank you so much, Stella, for that comprehensive answer. And honestly, I am grateful for what is being done even in Nairobi County. As a mental health advocate, whenever some parents call me and talk and tell me there's a child of mine who needs some assistance, or some youth come and tell me we need some counseling, I'm very happy to direct them to some public hospitals where they have set up with counselors and mental health practitioners who can be able to speak to those people. I know one in Mwiki, I know one in Kahawa West. So really do appreciate that. And most of the time, okay, I have seen it free so far. So those people who ask, can therapy be free? The government is actually doing something. Maybe we can see how we can market it enough for people to seek help instead of just killing themselves when the government is actually doing something. Really appreciate you for that, Stella, and also being here. Maybe you could answer this question from the chat box, since I can see you in your profile that you know something about substance use. So Chi Emmanuel is asking, can stress drug addiction or drug addiction cause mental health problems? Yeah, please, Stella.
Yeah, I think it's a twin. One can lead to the other. And when you look at stress, is the normal challenges we have in life. But when that one is not managed, when you're not able to cope with that, then you have likelihood of now going into severe stress, then other challenges like depression. Now that is now become a mental health challenge. When you look at substance use, it's one of the biggest drivers of mental health challenges. So you find that people who are using drugs are more likely to have a mental health condition, and people who are also have a mental health condition, like for example, anxiety, people with bipolar, people with schizophrenia, they are more likely to abuse drugs. So it shifts between the two. So it can start as a mental health condition leading you to abuse substances, or it can start like a substance abuse, because substance abuse in itself, it's already a mental health condition. So we say addiction, either drugs or alcohol in itself, is a mental health condition, and it's diagnosed as that. So yes, it can, and that is why we are saying, let's normalize seeking help when we feel that we have life challenges that we are not managing. Let's not just bottle them up. Let's seek help. Let's go to a counselor. Like Nairobi County, we have about 27 clinics. Let's have this conversation even at the family level. Let's teach our children how to be assertive, how to express their emotion, because that is one of the ways we are able to reduce people moving across the other side of having a mental health condition, but maintaining our mental wellness. Thank you.
Great, thank you so much. I like the fact that you have said, let's teach our children to be assertive, because for me, from my story, as you can see, how I didn't speak up, and that led to really severe mental illness. 18 years down the line, you can see, because we are not being nurtured how to be assertive. How can you know that your child is being abused or bullied in school? Yeah, thank you so much, Stella. We really do appreciate you for being here with us. We can maybe if there are some contacts for other people to reach you, so that they can even partner with you, or for more other questions. But we really do appreciate that you came here today. Thank you, Major Maina from Kujikuali. Thank you for being with us here today, and Emmanuel Odor. So let's go to Tony Kisaka. All right. Yeah, our panelist, Tony Kisaka, is he here today?
Good morning.
Good morning. Fantastic. We are so happy for you being here today. We have some questions for you. Maybe first of all, you can before answering the question, you can tell us what you do briefly, and you can tell us how technology and digital innovation can be leveraged so that you can have cost-effective mental health services to reach each community, even in the remote areas. We know that therapy or mental health services can be expensive. So maybe do a brief introduction, then tell us how can we use technology for mental health.
All right. Thank you very much. My name is Tony Kisaka. Tony Sikole. It is because of technology that we are already being able to have this this particular activity happening even. So to begin with, that's how important technology is for us. Wear quite a number of hats. One being I'm the CEO and founder of Futu Limited, which is an end-to-end consulting company. Besides that, I also sit at the Secretariat of the Coalition Action for Preventive Mental Health in Kenya as the head of strategy and member partnerships, which is a position that I decided to volunteer on because as a mental health advocate, and them seeing the amount of work and activities that I was doing in the mental health space, trying to just bring awareness and getting people to understand more about mental health. They brought me on board as secretariat, and also being a strategic advisor at Rescue 247, which is another entity which has primarily been in the emergency rescue, medical rescue industry, but has also now gone into virtual medical services, which also includes virtual mental health, we call it telemental services as well. So that is essentially some of the dockets that I actually sit upon and operate in. Now, in terms of technology, we've come to realize, and especially during the COVID pandemic and coming out of the COVID pandemic, we realized, and especially here in Kenya, hospitals like Madara Hospital, where before it was always assumed that any person who had mental health issues could always be just taken to Madara and they'll be taken in and they'll be given the treatment. But during COVID, Madara was one of the isolation centers, and therefore many families, many people who had people suffering from mental health illnesses and wanting to go there were being turned back because we're being told, no, you cannot be able to bring your people here because we do not know, number one, their status. And even for the few who are allowed in, the first thing you have to go do is do for them the COVID tests and all that. And you can imagine, when you're having someone who's got mental health issues, whether it's depression, anxiety, suicidal tendencies, whatever it is, and you're telling them that, no, first of all, we have to go and take you in for COVID, for a COVID test at that particular time, which was very traumatic because we didn't even understand what COVID was all about. And in light of this, we have seen quite a number of organizations and entities begin to now look into how do we now make this better in terms of whether it's from a medical perspective, whether it's from a mental health perspective, and especially mental health perspective, because in the past, the mental health perspective of our health was not as considered as any other area. There was too much stigmatization. People did not understand what mental health meant, mental health issues meant. They didn't understand that. People just used to think that, if you have a mental health issue, then you must be a mad person. Not understanding that, extreme anger may be considered a mental health issue. Stress, anxiety, panic attacks, things that others would have thought would be simple, just a simple thing that, and someone will tell you, why don't you just get over it? Not realizing that we're all built differently. And so this will affect us differently. And so we've started finding quite a number of entities. I remember there's quite a number of organizations that started looking for ways to be able to reach their clients. Many mental health practitioners, psychologists, counselors were now doing phone sessions. And then some organizations went further and began to now formulate some online platforms that they could be able to use to interact and engage with their clientele. And as we've come out of COVID and as we've continued, we've actually seen, let me call it an explosion of desire from people to understand more about mental health, and also an explosion of mental health practitioners, technologists coming in and trying to get tools out to the people that can be able to be utilized to be able to see, to put in the hands of individuals access to mental health practitioners, which would, number one, ensure confidentiality, number two, ensure that help is within reach and it's also affordable, because we've got to realize that when we talk about technology, yes, and for indeed some of this, the technology, putting the technology in place is not easy and it's expensive. But then when it comes to the clientele, because you're now reaching a wider spectrum of possible patients, you find, and again, because you're now no longer maybe in a brick and mortar, you're not having all the other normal overheads. The cost of getting mental health support was becoming less. And so more and more people are now reaching out and saying, yes, I've got a mental health issue. I just wasn't able to afford it before, but now because I'm able to get help at a cheaper rate, I'm able to get it from my, either whether is it my feature phone or my smartphone. So it doesn't matter where I'm at. I remember there's one of these online platforms where someone way out in northern Kenya, way out, was able to access and actually just try and get help, and they were helped. That is someone who normally would not have been able to get that mental health practitioner to help them at that particular point. And when I say mental health practitioners, I'm not just talking about, maybe those who are starting out, those who are maybe struggling, but we're talking about even the very high, the older, more experienced mental health practitioners who, before it was not very easy to be able to access them. Now they've become a lot more accessible, and with that, we've actually seen that even as a country, I think the other day I saw it was stated in the news that out of every 10 people, 4 people in Kenya have mental health issues. I'm seeing on the group right now, on the meeting right now, we've got 50 of us. So out of this 50, that means about what? That's about 20 of us. 20 of us here are struggling with mental health issues. I know I've had my own fair share of mental health issues, and that's how I became a mental health advocate, because I struggled with mental health issues at a time when I would say my world was crashing. I was having struggles at my place of work. My marriage was breaking, and quite a number of things were happening. And at that point, I really struggled because I did not know what to do. I did not know where to go. I didn't know how to access help. And interestingly enough, I got admitted in hospital, struggling with heart issues, only for the cardiologist to say, by the way, your problem is not the heart. Your problem is emanating from your mental health issues, the stress that you've been under. That you're struggling with is what has now put you in a place where you're, in terms of your physical health. And at that particular point, I made a point, and I actually decided on my own. First, I got assistance from a practicing psychologist. But besides that, I say that I will not allow mental health issues to affect my health in any way ever again. So I had to make a personal decision. And that's how I became a mental health advocate, where it is the one thing that helps me to remind myself as well, so that I do not slip back into it, that by helping other people, hearing those who need help and supporting them to be able to get the help that they require, I'm also able to now give therapy to myself. And in doing that, I've been able to see a lot of progression right from 2012 up to now, progression from when people didn't know where to go to now where there's so many, if you go to, let's say, Play Store, you can be able to download so many apps that will give you access to mental health support, physical health support as well. And it's a very, very interesting thing. And I can't wait to see where we're going to be going in the next generation, because part of what I do as well as a practice is helping organizations go to the next level. We're always looking to see how do we improve and how do we get to be more efficient and more effective. And so in this particular arena, I'm looking to be able to support, and even for the teams that are here, and with what we're doing, just to be able to see how can I as an individual, how can we as the Coalition Action for Preventive Mental Health, how can we as Rescue 247 continue to also use our knowledge, our understanding, our expertise, and everything that we've got to support all of us here, the youth, the organizations here, to be able to reach the next level. Thank you.
Thank you so much for that, Tony. And you have given an extensive answer, which is very, very helpful on how we can leverage technology. And honestly, we are so grateful. Thank God for the work that you do and the passion that you have towards mental health advocacy. And what I needed to know, actually what I wanted to say in regards of technology, sorry, I got distracted for a bit with the screen. When I was undergoing therapy, I downloaded an app, and it was a mood tracker app. And through the Mood Tracker app, I would see which places do I stay that really, really, really are not good for my mental health? Which people am I with that are really not good for my mental health? How long do I sleep and all that? And also teletherapy. Teletherapy is basically having therapy through your phone or your device, any device that you do. So technology has been of great use. And thank you so much for that, Tony, for answering that question very well. And Abu Bakari, we can see you on the chat. We appreciate you, we value you, and we appreciate the fact that you are here. Please leave your contacts so that we can be able to reach out to you on this session. We may not get time to have a conversation here on the screen, but please leave your contacts so that you can talk extensively and reach out to you. All right, I am Mr. Njeru. Thank you so much for being here with us today. I would like to ask you a question, and I can see there's someone on the chat box who had actually asked the same question. Mr. Major Minor had asked the same question. So first of all, before I ask the question, I would like you to briefly tell us a bit about yourself, what you do, and then I would like to ask, how can public and private partnership mobilize resources and leverage their influence to advocate for increased funding and support from government, international organization, and philanthropic entities, so that you can have a mentally thriving generation? So how can we partner and collaborate? Yeah. Mr. Major had asked the same question, so maybe you can begin on that even as he answers the question. Mr. Njeru, thank you so much for joining us. Take us away.
Good morning, everyone. My name is Rutere Njeru. You can also call me Kasmir. You can also check out Rutere Njeru on all social media platforms. I do a lot of activities around policy formulation, advocacy on mental health, advocacy on peace, and environmentalist. I'm also an environmentalist. So for the day, I'll be falling in as a certified counselor and a mental health advocate, stroke practitioner. I'm a mental health ambassador with the Scouts Healing Invisible Wounds, which is an organization, or rather an initiative that looks to build a more safer and a mental health accommodative environment for every young person. We interestingly also indulge in assisting the young adolescents and those in high schools and what have you, even in primary schools, to be able to bring out a more considerate approach towards mental health. Because with looking at the aspect of young people, we have those in high school who are yet to become youth, which is according to the Kenyan Constitution, which allocates the age of youth to be 18 to 35. So looking into the aspect of creating a safer society or a mental health environment for young people, Scouts Healing Invisible Wounds carries out a lot of initiatives around the same. We have an event that is running today, International Youth Day, happening at the Kenya Cultural Center. We also have a booth there. So if you're around town or around Nairobi, you can pay a visit today and tomorrow to be able to also engage and see what we do. You can also check us out on social media. So to answer the question on how best the private public partnerships can happen and how we can be able to mobilize resources, it is quite a wide way of getting to understand where we are at the moment. Looking at the Kenyan mental health policy that was set in place in 2014, which took a year before it was adopted by the Kenyan government that is in parliament. as a policy formulator, I feel that as a country, there are things and policies that create a barrier for us to be able to carry out some of these initiatives and some of these programs that we so feel that should be impactful to the society. If we look at the policy formulation, there should be a way that creates an opportunity and a space for all these mostly NGOs and other organizations to be able to carry out their activities without barriers, because there is the aspect of collaborating and being able to form a better way in which we can be able to mobilize resources. I'll start with saying that there needs to be an establishment of a common pool of resources. As an initiative in mental health, where can we mostly get these resources from? The government mostly is mandated to be able to serve its citizens in terms of health. When we look at mental health, it's also part of health, and having to look at the way that the health in Kenya is operated, there is the funding that goes to the health sector. In that, we can be able to also advocate for the government to be able to fund activities, to fund facilities, and to make available services of mental health in all the counties. Because as we look at the 2010 constitution that brought the devolved government, there is a devolvement of the county services in terms of health. So mobilizing and having an established common pool for resources would be a good approach that would be impactful, looking to it that we have accessibility to those in the local areas. I will give an example with Embu County, where I hail from. Embu County Hospital, the level 5 general hospital, has also allocated a wing that is that accommodates the services of mental health and psychological care. So when we look at that approach, and when we look at people who are already giving and taking part in ensuring that mental health of their people is taken care of, that can also be implemented in other counties, and not only in Kenya, all over Africa. Secondly, we need to look at an approach that does not only depend on the World Health Organization, because mostly in terms of statistics and what have you, it has been all about World Health Organization. When I look at some of the organizations that are linked to mental health in Kenya, there is one known as Africa Mental Health Research Center that is based in Upper Hill. When we look at such organizations, what statistics are there that can show where we are as a country and where we are as a continent in terms of the statistics, instead of depending on World Health Organization, because those statistics does not generally reflect the image of African continent. So we also need to have, as organizations in Africa, come together, bring our resources together, and be able to carry out research and statistics taken for the context of Africa as a continent. Secondly, we need to identify the stakeholders. Who are we going to partner with? Who can be able to provide these resources that we require? Is it human resources? Is it financial resources? Or what are we looking at when it comes to understanding the better part of who we are going to work with? So it is good that we identify stakeholders, because mostly we tend to blame the government, we tend to ask the government, we tend to always look out to be assisted by the government. But what can we do as private entities? I would look at it in a way that gets to the ground, whereby we can be able to bring out a corporate mental health initiative. Most people, a large percentage of people don't work in the government, and they work with companies and mostly in corporate. When corporate companies are able to bring out or set a pace where they can be able to accommodate the aspect of mental health in their companies and be able to accept the aspect of mental health being carried out, to be able to assist their employees, to be able to assist those who work with them, to be able also to spread and advocate for mental health in the workplace. I think we can be able to now close the gap between mental health services and the public in general. So while identifying the stakeholders, we also have to look at how best we can be able to sustain and to sustain the programs that we are carrying out and the resources where we're getting them from. In the aspect of identifying stakeholders, we also need to bring in the youth who will be the major beneficiaries in this. That is in terms of investing in their trainings, investing in their programs, being able to curate programs that favor the youth, and be able to bring them out in terms of telling stories, in terms of social media, to be able to carry out advocacy continuously where there is a sustainability. And we can be able to also close the gap between access to services and mobilizing of resources, whereby many people who believe that what we are doing is of major help can be able to come in. That there is the aspect of monitoring, evaluation, and creating visibility and documentation of the work that we are carrying out. Looking at some of the initiatives and programs, some fail because we fail to monitor how they run and how they are being implemented. So when we get to have a way that we can be able to monitor these projects and programs to the end and be able to also account for the resources that we have, then even those who are funding and bringing in money or in whatever way, resources that they are bringing in, will be able to also come in and be able to carry out this. I will give an example of the youth mobilization initiative, global youth mobilization. They partnered with the big six organizations of the youth. There was also the World Health Organization, the United Nations, the Scouts, YMCA, Girl Guides, and Duke of Edinburgh, that is in England. And in Kenya, it's known as the Presidential Awards. So they carried out a program where they advocated for mental health, and they were able to fund some of the organizations that were carrying out mental health programs and projects. Scouts Healing Invisible Wounds was one of the beneficiaries of the funding. And to be able to understand why there is an importance of being able to monitor, evaluate, and create visibility and document the work that you do, they did run a first phase of the program, and now they are looking to run a second phase because the first one was a success due to the aspects of which it was carried out in terms of monitoring, which was done well, the evaluation, and creating visibility, that is in social media and what have you, being able to show people what you do and being able to reach the young people and everyone that you want to be targeting. Thank you for that, and I'm looking forward to partnering with each and everyone that looks to partner with us as Scouts Healing Visible Wounds, and thank you to all the panelists. Thank you for having me.
Thank you so much, Mr. Njeru. You're doing a great job. Like I said, I'm sure many people here have said that they have seen Scouts Healing Invisible Wounds all over social media. And thank you for the 3 tips that you've given us for collaboration. Karibu sana, Dr. Stacy. Welcome in this meeting. And I would like you to briefly introduce yourself. Time is far much gone, but please introduce yourself briefly, and then please could you answer this question for us? Stacey.
Okay. Hi, my name is Dr. Stacey. At the University of Nairobi. As such, I work at Mathare National Hospital as well as Tranco Medical Center. So to answer the question briefly, I think one way we can take steps towards research and data collection is by using what is readily available for us. So our public space pool of individuals that are representative of our community. So I think one of the best steps we could take is using that facility as a ready source to conduct our own studies about mental health illnesses, about interventions that we have in place, about side effects of the medications that we have, to tailor them to the people we are working with in our country. So as of now, most of the data that we use comes from the Western cultures, because they are the ones who had the resources and the skills to do all this research in the past. So I think that would be one of the ways we could do that. And a public-private partnership would be in terms of maybe finding grants and public funding, because like Stella said, once the donors and this, what do we call them, this philanthropic institutions see that the government is investing in a situation, they're able to come in and better fund that for us. So I think that would be able for us to make good use of the resource we have available. That will help us navigate treating mental illness in our country a lot better, because if we continue to use data that is from other individuals, we'll continue to have the same complaints that we hear, where patients are having severe side effects from medication, or the medication is not giving us the desired results that we'd like. And it's simply because, not because we don't have good drugs out there, not because we don't have good interventions, it's simply because we're not taking the time to understand our people and what we need to do to cater to them. So I think briefly that would be a step in the right direction. Instead of relying on outside resources, let's pool our resources here. We have a lot of intellectual minds in the schools, in the workforce, that if we do our due diligence, we can do the research for our people, and that will help us navigate treating mental illness in a better way. Thank you.
All right, thank you so much for that, Dr. Stacey, for that brief answer and accurate. In case you have any question, this is our Q&A time. In case you have any questions, please go ahead and ask in the chat box.
Hello, good morning.
Good morning.
This is Hassan Ali Yusuf from World Vision Organization based in Northern Kenya. And I want to apologize that I've joined you lately. So mine is just to introduce myself and be with you in the next the rest time of this meeting. So if you will allow me to introduce more, I think I will go ahead and do so.
All right, you can introduce yourself, though this time is the time for Q&A, questions and answer, in case you have some questions for the panelists. And when you ask, that's when you get whatever you need. So in case you need contact from a particular panelist, please just write it on the chat box. Go ahead and write the question that you want to ask on this chat box. Is it Stella's contact, Njeru's contact, even on how he's able to market and influence Yvonne's contact, Tony's contact? You can be able to ask that on the chat box. And thank you so much for joining in for session 1. Is there any question on the chat box? Maybe Collins or Calvin can help me with that. Anything that I have missed on the chat box? Can see the last question we answered. Mr. Tony answered that question. Yeah. Since there are no other questions, let me give to either Collins or Calvin so that they can take over, and maybe you can give direction on Hassan. Thank you so much for joining this session. Have yourself a great day. My name is Yvonne Kihumba, founder of Jasiri Warriors, and I want to appreciate all the Jasiri Warriors who joined in. Otherwise, have a great rest of the day. God bless you.
Hello. Yes, thank you very much for that incisive and informative session we've had. Thank you much for our moderator. Thank you very much for our keynote address and keynote speakers and the panelists. I think we've grabbed something that maybe we were not aware of before, and we're just trying to make a society that will treat mental patients with a lot of care and with a lot of the attention and touch they require. So I believe that we are in the right track so far, and I want us to take only 1 minute break before we roll over to the next, the other session. So before we wrap it completely, we request that each panelist to give us 1 minute parting shot. Each person 1 minute. So I think I would start with Stella Wairuigi. If you are there, give us 1 minute parting shot. Then we'll go like that. We'll go to Rutere. Then we'll go to Yvonne. Then Sikolia. Then we'll finally finish with Dr. Stacy. So Stella, if you are with us, just give us 1 minute parting shot. Thank you. Okay, sorry, I think Stella is not with us. So if you are there, Rutere, Jeru, please give us your 1 minute parting shot.
Looking at the end of this, I'm calling upon all private and public institutions and organizations to be able to train as many young people as possible. And yeah, we can also look at the Kenya mental health policy, where we can implement the policy to be able to carry out mental health activities. And lastly, let us focus on the sustainable development goals, that is partnerships for the goal, number 17, good health and well-being, number 3, quality education, number 4, and even all the other SDGs that are interconnected. Thank you.
Thank you very much. Yvonne, if you're with us, please give us your 1 minute parting shot.
Thank you. My parting shot would be to call to the government when they're making the mental health budget or the health budget, to also include the mental health practitioners here and there, so that we can be able to advise each other on the areas that need funding and the areas that we might need to put more interest in order to be able to make a mental health sustainability a reality. So we really need more funding in that aspect. We are still at negative. We are not even at 1%. And according to the African Union agreement some time back in 2001, the agreement was to maybe get to a point where we are at 15% of budget allocation to the health dockets. So it is my call is to all. It's for the government and all these other parties to include the mental health practitioners when they're in these discussions, when they're making these forums and conferences, so that we can be able to advise each other on how best to go about this. Thank you.
Sorry for that.
What I have not seen any. Okay.
Hello? Kindly, Kisaka, go ahead.
All right, thank you very much. Me, I'll say that I'm really happy to be able to see how far we've come, especially in the mental health space. Traditionally, everybody has always considered when you talk about when you're talking about health, people have always talked about physical health and thought about physical health. But then seeing mental health begin to take its place in the industry is a really encouraging thing, because even when you think about physical health, many times when you come and ask us, when you come and look at the numbers of people struggling with mental health, you'll find that there's a very large percentage of them who get into mental health issues because of the physical health problems that they're having. So going forward, I trust and believe that we shall continue to be able to focus a lot more on the mental health aspect and not just physical health. Thank you.
Thank you very much. Dr. Stacy, if you're with us, please give us your 1 minute parting shot.
Thank you for that. I think for me, what the parting shot for this would be with the topic we have is, for there to be any success with private-public partnership, I think we need to eliminate the bias. There's the bias that one is better than the other in different regard, and depending on who you speak to and what is being addressed at the moment. So I think once we eliminate that bias and realize that we are actually working together on both sides, and create trust and respect and credibility, where when the public sector is assisted, they are carrying out things in a credible way, and in the private sector as well, so that no one is feeling like one or the other is out to benefit from the other. So I think that elimination of bias would be a right step in establishing more private-public partnerships. Thank you.
Thank you very much, Daktari. And at this point, I want to thank all the people who have made this session a success the way it has been, all our delegates, our moderator Kihumbi, our panelists, Dr. Stacy Njani, Stella Warwigi, Rutere Casimir Njeru, Yvonne Amolo, and finally Tony Sikolia Kisaka. I want to thank all of you for having taken part in this discourse. And I believe we have emerged here people who are more informed, and at least we are able to take care of mental cases better than we do and be always proactive. I always like one slogan we shared sometimes back: it is okay not to be okay. So I want all of us to take that concerted effort towards a society that recognizes mental health as part of one of the illnesses, not a condition or maybe a traditional thing. Thank you very much, ladies and gentlemen. I want us to take only 1 minute. Before we take the 1 minute just to break, we go to the next session, I want to call upon Collins Alan to give us just one brief. Thank you very much.
Thank you so much, Mr. Kaumba, for that. And thank you so much, the panelists. It was such a thought-provoking discussion, and it's something that we are not going to stop discussing, and now the way forward. And at this moment, I would like to request participants not to drop, because the discussion that we are going to have is very important and is touching on the pandemic preparedness, youth-centric approach. And you remember during the pandemic is the moment that mental cases arise. So at this juncture, please just hold on and let us be part of the discussion. And out of the discussion, we'll be able to come up with solutions that will be inclusive and will help the youth overcome in case of any occurrence of such. So at this moment, ladies and gentlemen, let's have a 1 minute break. Then we can come back as soon as possible to kickstart our next session, which is pandemic preparedness. Thank you so much. Ladies and gentlemen, I hope you can hear me loud and clear. So for those who are joining us right now, my name is Colin Salandundo. I'm the interim CEO for Youth Initiative Development Program. So kindly, I believe you've already grabbed a cup of tea or a cup of water. I know virtual events sometimes is tiresome, but we thank you for your time and we thank you for your contribution. We had an engaging first session, and we believe we'll continue with the continuation of the conversation towards building sustainable community for the youth. At this point of time, I'll introduce our moderator of today, who is Yonela Spolane from Youth Health Africa, which is based in South Africa. So I'm not going to take a lot of time, but I'll just echo one thing, which is very much important, and it's so much into young people's heart. So we all understand the situation when COVID hit us. It was unfortunate that we lost so many lives, and most of the people that were seriously affected were the youth. And these people lost their jobs, they lost their lives, and also their mental well-being was affected negatively. In this conversation, I urge you to open up and make it, we'll try to make it as engaging as possible, and try to ask questions that will help us narrow down some of the critical things that different stakeholders can work collaboratively, so that we are at par, so that we'll never feel any effect of any calamity. So at this point, let me welcome Yonela Spolane. If you are there, please, you can unmute yourself. And also, I know delegates also like to see you. You can also start your video kindly, so that we hear your voice. Yonela, over to you.
Thank you. Good morning, Collins. Good morning, everyone. I hope that you can hear me very well and that you can see me.
Yes.
Great. Thank you so much for inviting me to be part of the session today. I think what you've mentioned and the topic that we'll be covering today is something that, you know, I know quite a bit about, just from personal experience, but from a, you know, a point of view of just engaging with the different perspectives is something I'm looking forward to learning about. My name is Yonela Dzibulani. As Collins had mentioned, I am based in Johannesburg, South Africa. I'm working for an organization called Youth Health Africa. So essentially, our role within the topic that we're discussing today is quite prevalent. Youth Health Africa's work started in, you know, the heat of COVID. We were fortunate enough to get young people to work within the space of vaccinations. So really, I'm here to learn from other professionals today, and also just to hear the different perspectives on today's session. Yeah, so Collins, can we get started? I suppose we can. Okay, so I guess.
Sorry, I am here.
Yes, okay. All right, no problem. So I think if we can start off just from a round of introductions from all our panelists that are in the session today. I just want to make sure that everyone is in the session. Is Judy in the session?
Yes.
Hi, Judy. Perhaps I can start with you. Hi, Judy. There seems to be a bit of noise back on your side. Okay, so maybe
sorry. It was from Judith.
Yidp Mandela.
Okay.
Judith, maybe. Okay, thank you so much, the technical team. Yes, we have our team with us. Unfortunately, we'll not have Nashon. He was engaged, and then we'll have Chris Kaniki in our last session, and he will give a keynote speaking and he will also participate there. So we'll have Judy, and Perry Kent is in as well as Brian. Go ahead, please.
Okay, no problem. Thank you so much. So we've got Judy, Perry Kent, and Brian. So maybe we can just start off with a round of introductions. Brian, perhaps you can introduce yourself first. Brian, are you there? Okay. Can we have Perry Kent?
Is having some technical problem. Please start with Judy.
Okay. Hi, Judith. If you can go ahead and introduce yourself, please. I'm hoping that it's not a technical issue on my side. Collins, can you hear me?
Yes, you are loud and clear.
Okay.
I think Judy is on mute.
Okay. Are we still not having anything from Brian's side or Perry Kent's side? So I think perhaps in the meantime, while I'm just trying to get everyone's technical issues sorted, we can sort of engage more on the topic that we're discussing today, just to see where everyone is coming from within the session, the different organizations that we're connecting with, and a conversation around strengthening preparedness and resilience for emerging threats is something that, as Collins had mentioned, is very near and dear to all of us. I think we all experienced many different phases and layers when we're talking about things like COVID-19. As young people, it's something that you never thought that you would have to prepare for. It's something you never thought you would have to equip yourself for. And as Africans also, it's never, things like being told that you can't connect with people, you can't touch people, you can't sit with people. Those were things that we really never prepared ourselves for. So I think the conversation is really, especially from a youth point of view, how can we equip ourselves better as young people, as Africans, to better prepare for things that are going to come in the future? Because I think we have now seen that those things are very much possible. Those things are potential and they can come at any time. So how can we really equip ourselves to be better prepared for those? So do we have Judith? Do we have Brian? Do we have Perry Kent?
Yes. Yes, Judy, Masharia, kindly unmute and go ahead. You can unmute and continue.
Okay, Judith, you can go ahead. Hi, Judith, I think you're on mute. Okay, let me just have a look. Okay.
Sorry, Yonela, sorry.
Hi, yes.
I think we're sorting out the technical aspect of Judy and Perry Kent. I think they've dropped in their respective places, but they're joining. I'm seeing them joining. Just continue giving us some highlights of the same. Once they're ready, we'll give you a thumbs up.
Okay, not a problem. I see there's a hand from Emmanuel.
Yeah, it's Emmanuel. Yeah, from Cameroon.
Yes, Emmanuel, you can go ahead.
Yeah, I just wanted to react on the point that you raised concerning COVID-19. When it came in Cameroon, it was so difficult for people to actually really welcome it. It was difficult, and then we find people dying in homes without them going to the hospital. We also realized that many older people were scared to go to the hospital and they end up dying at home. So now, at the first point in time, the hospital attendants start taking notes of the different corpses that came to the hospital, and they had to run the tests to the different corpses. That is where they could be able to get some of the statistics. So now with time, we realize that people are dying day in, day out, day in, day out. With the youth not being involved in this, people will just have, if you have a little bit of cough, you don't even realize that it may be a sign of COVID. At that point in time, it is difficult for persons to visit the hospital. So the crisis that we had so many lives because of ignorance. As they were ignorant, we lost so many lives. And I, as a coordinator of my organization, there are so many times in which I just say, I need to get to the community, talk to people about visiting the hospital and knowing what you have to do in order when you have a problem with yourself. Reasons being that there are some of us which are living in the community, which in one way or the other have transmitted the infection to the people who have a weak immune system, and it affects them. As they have a weak immune system, it affects them. It is a real problem because it may affect you, which you have a stronger immune system, you transmit it as an airborne disease to someone that does not have a strong system. So some of us in our homes, we killed our parents, which they are having a weaker immune system. Therefore, I look at it as a real problem when COVID-19 came in, because the acceptance of the community was so timid. People did not want to accept that it is a problem. Take it into consideration the environment in which I live in. I live most especially in Cameroon at the northwest region, where we first of all had the crisis that is going on. So people took it as the government wants to, first of all, use that to fight the crisis. So when statistics came up, they had problems to accept that statistics. They said it is just a myth. But
Hi, Emmanuel. I think we lost you a little bit there. I'm not sure if you can still hear me. Okay, I think we lost Emmanuel there, but I think what he's mentioned is very, very important. Just the community and the attitude around COVID-19 was very difficult to overcome. Everyone can see what's going on, but people's point of views were quite difficult to manage. So I think it's very interesting to hear the different ways in which different countries, we were dealing with it in different ways, but I think we sort of had similar challenges. So for example, from a South African point of view, we also had a challenge with, where, it came to the point of young people whose mindset was that, no, this virus is not going to do anything to me because I'm young. Then we saw a high number of young people losing their lives to this pandemic. Hi, Judith, I see your hand is up. Welcome. If you can hear me, then you can just unmute your mic. Okay, I'm not sure if perhaps Judith is still having some technical difficulties on her side. But yeah, just to echo the sentiments of Emmanuel, we really did have a lot of challenges from the point of view of the narrative. And I think from my side, in terms of how we can equip young people generally is with knowledge. You know, getting them to understand, you know, there was a lot of conversations, there was a lot of speculations, there was a lot of conspiracy theories that were very damaging to people within our communities. You know, there was all of these kinds of point of views that COVID is a white people disease, COVID is, you know, a conspiracy by the government, a lot of things that we dealt with, especially within the community work that we did that, you know, had a very, very negative impact on the work that we were trying to do. Hi, Judith, can you hear me?
Judith, kindly unmute your mic, then speak. I can see you have a concern, just unmute and then speak.
Okay, perhaps I can just send her a message in the group. Sure. Collins, perhaps you would like to just add just with regards to the resilience for the emerging threats. I'll see if perhaps Judith will be able to respond.
Okay, thank you very much, Yonela. In the meantime, there is a technical hitch from our panelists. And so Collins is trying to coordinate that. So kindly let's just have Q&A. We can engage in Q&A in the meantime as we sort out our panelists. It's unfortunate that we've had them having technical issues in their respective places. Those are different places. So we are just solving it in a few. We'll be back, but we can engage in a Q&A. Any concern we have in our chat boxes, and anybody who has a concern can raise their hands and we'll be able to respond that accordingly. So let's welcome that so that we don't waste a lot of time. Thank you.
Okay, not a problem. Thank you so much. So I think from my side, as I said when I started, one thing that I'm looking forward to is to hearing from, you know, the different countries in Africa, how, you know, your experiences were with regards to things like COVID.
Excuse me.
Yes.
Yonela?
Yes.
Perry Kent is already with us, so we can engage him.
All right, not a problem. Hi, Perry Kent, are you there?
Yes, I am. Good morning, everyone. Apologies for I dropped off earlier. Good to see you.
Not a problem. Not a problem. Thank you so much for joining us today. We really just kicked off the conversation from sort of talking about different points of views around emerging threats. Obviously, the one that we're speaking about in particular is COVID-19. But I can definitely give you the floor, and you can just start off by introducing yourself. Thank you.
Thank you so much. My name is Perry Kent Nkole, and I work with the African Alliance. And I am the current project lead for a project called Ports to Arms, which is a public health accountability intervention that tracks vaccine barriers as well as enablers in several African countries. And so far, we've been able to, do some work in the DRC. We've done some work in Rwanda, Burundi, Malawi, Zambia, South Africa, as well as Egypt, just looking at, issues around data with regards to vaccine access, and also just tracking barriers as well as good practices on the ground. And we're able to document a good number of best practices from the COVID-19 pandemic. And we're monitoring closely based on the recent announcement from the WHO that, COVID-19 was no longer, a pandemic or a threat to the world. So we're monitoring closely in terms of data, what the numbers are. But also, I think top of the agenda is that we are very keen on ensuring that communities across the African continent are prepared with regards to a potential future pandemic, with regards to alerts as well as access to vaccines. So basically, that's part of the work that we're doing, largely attributed to meaningful community engagement, as well as decolonizing data in Africa. Thank you.
Thank you so much, Perry Kent, and you're most welcome. The work that you're doing sounds very interesting. And when I started the session, I basically said that more than anything, probably much like everyone else here, we're here to learn about, what different youth leaders in African countries are doing in terms of strengthening preparedness and resilience. So I think I'll just kick it off by asking you, so what are some successful examples of youth-led resilience networks and initiatives that have prepared young people to respond to the threats, at a local, national, or regional levels? Because I would definitely imagine that, there's different dynamics and different layers to this conversation.
Yeah, thank you so much. So I think with regards to good practices, specifically focusing on young people, I think to a large extent, we've seen that, social media has been used as a platform that young people have used to engage. If we just take a step back at the COVID-19 pandemic and what had happened during when the pandemic was at its peak, we were mainly relying on online media to be able to get the right information and accurate information. With regards to youth engagement, I think what we saw lacking, and I'll speak on the negative as well as the positive. What we saw lacking was the fact that there wasn't enough meaningful engagement of communities because of the nature of the COVID-19 pandemic, where people could not physically interact. There was a huge disconnect between communities, and in this case, young people, and scientists, communities and their leaders. And so we saw that, there was still a good number of, youth initiatives or youth-led initiatives, across the African continent that were able to just stand up and be able to, hold their leaders to account, as difficult as in as much as the situation was a bit difficult. So I think for us, we were mainly picking up on what the gap was with regards to access. And I think, but if you look around, I don't think Africa is lacking when it comes to youth-led initiatives, organizations, or indeed interventions, that champion meaningful youth engagement. I think what young people need in this case is support and capacity augmentation and strengthening. Because I think when you look at the nature of what had happened during the COVID-19 pandemic, where there wasn't enough community mobilization and community engagement, it did provide an opportunity where young people can be engaged and, meaningfully, and be able to, hold their leaders to account. The work that we're doing around community-led monitoring provides an opportunity where youth-led initiatives, young people themselves, can be able to be the ones that take the lead in holding their leaders to account. And in this case, we're talking about, data collection, data analysis, and these co-analysis sessions, with communities. This is where young people can come in very handy in ensuring that, raising awareness on access, the importance of vaccines. Right now, what we have seen is that there's a huge disconnect between the science and communities. And I think because young people are the new age, who are much more savvy with technology, they are much better placed to be in a place where they can, take the lead in innovation with regards to, decolonizing the data space and data flow and data collection in general within the African healthcare, system and context. Thank you.
Thank you so much, Perry Kent. I think you touched on a lot of very relevant and significant points, just from the experience that we've seen as we had mentioned and as we know around the COVID-19 pandemic, because it was difficult and nearly impossible to interact with people, we relied on digital media, social media, and I mean, that's really where young people thrive. So I think with regards to the networks and initiatives, I can definitely also second that social media really was something that played a huge role in terms of getting information across, because we were then able to see how different countries were dealing with the pandemic, how it was affecting them mentally, how it was affecting their communities. And the community and youth-led initiatives that you mentioned are also very, very important. And again, just with regards to the importance of young people and holding government officials accountable is something that we also saw beginning to emerge. And I think it's something that's very powerful for us to find our voice as young people as well. So thank you very much for that. I think then my next question, just with regards to how young people were dealing with the pandemic and our families and our communities, is how can we then best address the mental health challenges and the social supports needed of young people during the crisis? And what role can peer support play in fostering resilience? Because as we said, even though young people, we were not able to interact, I think we really leaned on each other and we needed community and peer support during that time.
Is this question directed at all the panelists? Just guidance, Chair.
That one is specifically for you, if you can take that question.
Yeah, thank you so much. I think firstly, one of the major issues that came out of the COVID-19 pandemic was issues of, high levels of unemployment that came up as a result of, loss of jobs. Schools were closed across the world. There was a huge sense of uncertainty, and there was a huge social disconnect that came about. Now, mental health issues did not just come about during the COVID-19 pandemic. These are, health issues that have been around for a long time. And so when you look at some of the challenges that we had with the COVID-19 pandemic, one of the major challenges was misinformation, myths and misconceptions, and this huge sense of uncertainty. And I think one of the major challenges that young people face globally as it stands is unemployment. And I think it was a huge blow for young people, many millions of young people that have lost their jobs across the African continent. And of course, many young people out there who, despite being unemployed, have taken initiative and taken the route of entrepreneurship, could no longer do their businesses as they did before because of the fact that people were not able to interact, except for for a few who were able to use digital spaces to be able to do their business and conduct their business anyway. Looking at how economies were affected and how countries were ill-prepared for the COVID-19 pandemic, it brought about a huge sense of uncertainty. And I think for me, when young people lost their jobs, they couldn't do business, it sort of now, it was like adding fuel to fire with regards to mental health issues, because there was so much uncertainty. The world was on shutdown. There was so much little social interaction because we couldn't interact, as human beings. But I think what it brought up also is an opportunity for innovation, for people to still be able to trade, to make money, to work, virtually. And I think that's an opportunity that came up. And I think through the COVID-19 pandemic, we were able to see the resilience of the young people, in their ability to emerge from a global crisis and be able to still, move forward with regards to, the ability to still earn a living. So I think because our people, especially in Africa, were now torn between livelihood and life, it became much more difficult because on one hand, they couldn't fend for themselves, they couldn't fend for their families, but on the other hand, there was this global threat that was killing millions of people across the world. So I think we need to mainstream mental health within the healthcare system. I don't think we've done a good job at that. And right now, many healthcare systems across the African continent are trying to mainstream COVID-19, within the health system, because right now, if you look at many, scenarios across the African continent in terms of the healthcare systems, you would see that COVID-19 is still quite separate from other, health interventions within the healthcare system. So I think there's a huge part of, mental health that should be talked about. And these are not conversations that are happening as much as we want them to happen. We saw, rates of suicide sort of escalating during the COVID-19 pandemic. People had lost their jobs. And I think because the world is now moving on sort of from the COVID-19 pandemic, we want to pretend as if nothing happened. People lost loved ones, people lost their jobs. There's so much that we lost from the COVID-19 pandemic. But I think when we talk about pandemic preparedness and resilience, we should talk about the individual. In as much as we are talking about nations, we're talking about systems, we should be able to talk about how do we ensure that we put in place psychosocial support for individuals to ensure that when a pandemic does come, there are some social structures that ensures that the individual has, some sort of support when all of these things are happening. We can't talk about pandemic preparedness for communities, systems, and countries without talking about pandemic preparedness and resilience for the individual. How do young people position themselves and ourselves much more specifically economically in such a way that even when a pandemic comes, there's innovation for alerts, there's innovation to ensure that the world doesn't shut down as much as it did before. So I hope we get to a place where we have those conversations that when we talk about strengthening pandemic preparedness, we also have a focus on the individual. And in this case, the role of young people is very important. For me, what stands out is innovation, the ability of young people to emerge strong from a pandemic with more innovative ideas, and just keeping it going and keep earning for a livelihood, but also taking care of themselves. So I think we need to put those systems in place that ensures that the individual is at the center. And because when individuals are prepared and resilient, then communities are resilient, then nations are resilient, then the world is resilient. So I think mental health issues were one of the key issues that came out from the COVID-19 pandemic, owing to the issues around unemployment, people losing jobs, and of course, people not being able to do business as usual. Thank you.
Thank you so much, Perry Kent. Again, you really did touch on a lot of points. Very, very crucial for us to have a conversation around, if we're talking about resilience and preparedness, we also need to think about the fact that we're dealing with human beings, the fact that we're dealing with people's mental state, when so many things were happening. I think when we're thinking about young people's various challenges even before COVID hit, there's already high numbers of youth unemployment within our countries, our communities. So you can imagine that extra layer and that extra dynamic that comes in with regards to now you're not able to work, you're not able to earn an income, you're not able to, do any kinds of entrepreneurship, and you're also dealing with, these various issues that are coming about. So thank you very much for that. I just wanted to read a comment from June in the chat box. I was a second-year student when COVID hit, and in third year when schools were reopened, mental health among the youth was a really big challenge. Having to go back home led to withdrawal, as most of us couldn't mingle with our fellow peers, nor talk to our parents or guardians. I was a victim of anxiety, and apparently so was 70% of my friends. Yes, that's one thing that I can definitely relate to, and I think most of us can relate to. I really do think that a lot of us dealt with the COVID pandemic in a lot of different ways. You know, there was a lot of many layers of things that were coming about. And I'd definitely like to open the floor to anyone who would like to share their experiences just around, you know, maybe their personal experience dealing with COVID-19 and how you're dealing with it now, because, you know, we're maybe not talking about it as much. But for example, we're still working in ensuring that communities are getting vaccinated. We're still working on ensuring that people are having those conversations. You know, COVID testing is still happening. You know, it wasn't a trendy virus or something that was just happening at the time. Yes, we have a hand from Zachary. You can go ahead.
Hello, good morning, excuse me. Good morning, ladies and gentlemen. I'm so proud and happy to be part of this session, you know, listening to all the fantastic speakers and all that. Well, I just want to share an experience. I work with a non-profit organization called PAC Initiative Africa here in Nigeria. And during the COVID-19 pandemic, we realized that there was panic among everybody, regardless of whether you're a healthcare worker or non-healthcare worker. Everybody was panicking because of the COVID-19. The coronavirus was quite novel. People understood little about it. So what we did, we realized that most of the healthcare workers were even running away from their duties just because they were scared of being caught with the disease, so to say. So you can imagine if the healthcare workers who are meant to provide you with the care and are being skeptical in doing that just because they were scared of their lives too. So the point I'm trying to drive at, we realized that the capacity of the healthcare workers wasn't built for them to be pandemic ready, because if their capacities were built to resist or to fight any pandemic, they would have certainly know what to do. And in our own wisdom, we had to come up with a simple intervention, which we tagged the COVID-19 Train the Trainers, which was a capacity building program on infection prevention and control for COVID among healthcare workers targeted at the primary healthcare centers and some selected facilities in Nigeria. And upon this capacity building, their confidence were restored and they were able to deliver. So the point is, in Africa, we don't have to wait until we're hit by a pandemic. We need to ensure we improve our pandemic preparedness, pandemic response, and pandemic recovery, because it's going to go a long way. And one of the ways that that can be done is through effective health system strengthening. We should ensure that all the 6 building blocks of health system strengthening as outlined by the World Health Organization are well strengthened. Talking about governance and leadership, access to medicines and health commodities, financing, information system management, you know, service delivery, human resources, you know, and what have you. Thank you very much.
Thank you so much, Zachary. You know, what you mentioned, something that really stood out for me in terms of what you mentioned, especially along the lines of the human element of the healthcare that we have access to, because I think it really, the pandemic really exposed, for example, that we're not as prepared as we should be. The importance of the human element when it comes to healthcare, and also the fact that, you know, there isn't a lot of access for basic human rights when it comes to medicine, when it comes to human resources, when it comes to just the general access, you know, because we couldn't blame the healthcare workers for being fearful for their lives, you know, because of the lack of preparedness within our public healthcare systems. This is something that was immediately apparent, especially within South Africa, where healthcare workers were fearing for their lives. You know, they were complaining about lack of access to adequate PPE. You know, there was a huge narrative around masks, around wearing gloves, around everything. So it really just sort of exposed the importance of having access to the basic things that we take for granted. Thank you so much for that. Collins, I just wanted to check, is Judith still going to be joining us?
Yes, Judy is in.
Okay, is she online right now?
Sure.
Okay, sure. Hi, Judy, are you online with us?
Yes.
Hi, Judith, how are you?
I'm very fine, and you?
I'm good, thank you. We're so happy that you could join us. We're just having a whole discussion around the topic for today. I think you can just start off by briefly introducing yourself, and then we'll definitely get some insights from you.
I'm not Judith Macharia.
Okay. Oh, sorry. I guess there was a mistake there. Apologies for that.
Yeah, good morning.
Yes, good morning.
Yeah, my name is, I'm Julius. Hello?
Hi there. Yes, you can go ahead.
Yeah, my name is Onia Julius Olasode. I'm presently in Nigeria and also in Nigeria. I'm a teacher and also a trainer. For some time now, I've been working with youth in secondary school. We try as much as possible to balance their educations and their mental health. You know, one thing that is very common that people don't look at is student performance. Students, they can easily get derailed when they put in all their effort to study and they are not getting it right. Another thing is that when they see their other colleagues doing well and they are not doing well. So teaching is not just only about not only about academic success. It goes beyond that. You know, one of the things that make me stand out as a teacher is that I try to discover a student, to know his strength and his weakness. And from there, I motivate. I spend few time in the classroom motivating students, telling them what they can do, how they can manage their self. Other students, they admire what they do out there when they are not in classroom. You know, some people will just, you are not serious, this and that, this and that. Many students have chat me many times that they don't even understand, they want to commit suicide. Then I keep asking why. Anytime I read, I forget this and that. So I think learning should just go beyond academic success. We need to understand students. And one of the major challenges in Nigeria is, you see government school, you have like 70 students in a classroom. So teachers don't actually have a direct access to one-on-one. So I, as a person, I have a platform where you have a direct link to students. They can privately chat because you don't know them. So they can easily tell you what they are going to. So we'll be solving that problem. We don't need to see you. We just want to know what you are going to, and we'll try as much as possible to provide a solution to that. Thank you very much. Thank you.
Thank you so much for that. I think really it's bringing up a lot of sub conversations and sub themes around how do we engage with young people in a way that they will understand, how do we connect with them beyond just the general education that you were talking about, beyond just what we think we know and what we think we understand. So I think your point around, education and engaging with young people should go beyond just the platforms of academics and really trying to get to the basis of that. I 100% agree with you. Thank you so much. I also just wanted to read Perry Kent's point before we close up. One crucial approach that worked in the past, HIV and TB, is community mobilization led by young people. This approach works well for raising awareness, increasing demand and access to health services. This calls for more investment in youth-led interventions, capacity building, and resources. Definitely something that, in Youth Health Africa, we tried to, it's something that we really focused on in terms of demand creation, and putting young people at the center of that is very, very important, because you're able to meet other young people at their level. You're able to engage with other young people. And as Perry Kent had mentioned, it's something that worked very well for HIV and TB. And we have found in the projects that we've been working on with young people in our initiatives at Youth Health Africa, to really get young people to be the leaders and the initiatives of these community-led engagements. We have a hand from Lizzie.
Hello, how are you? Just a quick one, which I don't know whether it's a question or maybe an insight. I mean, we do talk about pandemic preparedness, and we've seen the pandemic fund already being set up. But the question is, which role are we giving to the youth? And I don't know whether that can be taken up by any of the panelists, but also maybe to kind of direct a question to Perry Kent in terms of the work they do under Africa Alliance. How are they ensuring that even the projects that they're running is more youth-centered than, coming up with a project and then later on trying to squeeze in a youth just because it's a requirement of the one to look like, they're youth-friendly. The idea is to start looking at youth from the onset of projects, the inception area, not during the implementation. It would be good just to know how Perry Kent's organization actually tackles such an issue. Thank you.
Thank you, Lizzie. I see Perry Kent had said that he has to drop off. I'm not sure if he's still on the call.
Yes, Chair, I'm here.
Okay.
I'm here. Just typing that message. Yeah, thank you so much, Liz. In terms of young people taking the lead, and I think that this is something, and this is something I've noticed for many, civil society, organizations that claim to preach meaningful youth engagement, but it is not entirely reflected within their, internal organizational systems. At the African Alliance, I think what you will see evidently is that most of the interventions, Barak is here, who is part of the, PVA Africa. I lead the Ports to Arms intervention, which is an intervention that's implemented across different countries. And I think when you have young people that are taking the lead, you find that, there's much more innovation. And I think there's a deliberate effort to ensure that the representation of the needs of other young people are a priority. I think one of the most difficult questions that we have had is the issue of representation. The fact that one young person might not entirely represent all other young people. There's young people living in rural areas. There's young people living with disabilities. There's young people, who are part of the, spectrum for the LGBTQI in terms of key populations. But I think just having young people in the lead itself is an opportunity that opens up a conversation for more inclusion and inclusivity. At the African Alliance, I think what we have seen is that there's a deliberate effort is that there's a deliberate effort to be able to put young people in the lead, but not just putting young people in the lead, is to build and strengthen their capacity, and so that they can be able to thrive, and their participation is indeed meaningful, because it's one thing to put a young person on a panel discussion or on a platform to speak, and it's another to get some substantial, content. Young people know what they want. Young people understand their needs. What they need is the platform, but also their capacity to be able to articulate those challenges, and be able to bring up a case and argue with technocrats. I think it is an appeal to institutions and organizations that advocate for meaningful youth engagement. That should reflect within their systems. They should be able to build the capacity of young people. And when we talk about including young people, we're not just talking about bringing young people on board as interns who are making tea for the CEO, but bringing young people in the room, strengthening their capacity, let them understand the issues, the technicalities of the issues, and let them be able to represent other young people and be able to articulate their needs, because we can't talk about young people without bringing them on board, because they themselves understand their needs better than anyone else. So to answer your question, Liz, we do have a deliberate approach within the Alliance to ensure that, many interventions are actually led by young people. Thank you.
Thank you so much for that, Perry Kent. I think you've really summarized, a lot of the conversations that are happening in the chat box around, overall, give young people the platform, give them a chance. And, when we say give them a chance, don't put them in the back, don't put them as an intern to make tea or coffee, don't second guess or ask their opinions at a later stage. Include them in the initial processes and the initial plannings, in the initial engagements of really just moving forward, especially because we're trying to build sustainable communities, and the young people like ourselves are the ones who are going to be part and parcel of how communities are going to sustain and going to. We can definitely, Perry Kent, I don't know if you have any closing remarks for us before we end of the session for today.
Yeah, and I do, because I have a chance to what the organization praise and to sisters. One of most the interns that I've during 19 it can't that able to reach their vaccination targets, like Zambia, for instance, when we went on the ground in the rural for this country to get to their national health workers going into the community, mobilizing communities, civil society, taking the front in raising awareness to increase demand. Such very basic local interventions are what worked for countries to attain the national COVID-19 vaccination, targets. So I think this is, and because young people have the energy, they have the numbers, they have the innovation, they're able to even find better ways of mobilization. We've seen this work even in during political, election times, where communities that were able to mobilize, communities that were able to engage, were able to actually get more numbers for people to vote. And this works, in the same way for access to health services as well. I think we should build the capacity of young people and strengthen community-based interventions, because that's where the action is. You see, health systems are not transformed in boardrooms at WHO or in our fancy, workspaces. We see change and we see impact on the ground within the communities. And when communities are pushed aside, we can guarantee that there would be no, room for strengthening preparedness and resilience for emerging threats. Thank you.
Thank you so much, Perry Kent, for your insights. And thank you very much to everyone who participated today. I am really honored to have learned so much from you. I'm really honored to have you'll be able to share your insights and your stories. And I'm hoping that, we can really connect further and continue with some of these conversations. Thank you so much. I think I'll hand over to Collins to close for the day. Thank you.
Okay, thank you very much, Leonela Tivolani, for the great work we've done there. Even though we have a few technical features here and there, but believe that we have a very interactive session and discussions that are at least opened up our minds. And at least now you're better off informed on the course that actually we need to take. I submitted a few points that we may share together. I think we need to have youth involved in their program. So that is very, very important. So any youth-centered activity, I believe it will be able to make the required impact. And also one thing I also realized, we need the community mobilization that Kent has talked about. And also we need capacity building, which is very, very important in youth engagement and youth-centric kind of approach to issues. So I think I want to thank you, Leonela, for your moderation. I want to thank our panelist, Perry Kent, for that, the insights you shared with us. And I believe we gained something. We are sorry that we had technical issues for most of our, or some of our panelists, but I believe that we are going to adjust to that accordingly. So to this effect, I would like to call on Collins, just say one word, and then we are going to transit to the next theme, which is going to usher us into lunch. But in the meantime, I think Collins is also running up and down and getting technical issues. I don't know whether he's already there. I'm seeing him trying to adjust. So in a special way, we thank all those who have raised questions, those who have shared their concerns in our chat box. I was also following up from the chat box. It was very interactive, and I believe that we have also learned something from there. In a special way, thank you very much, Sibolane, for your sharing. Welcome, colleagues.
Thank you so much, Mr. Kaumba, for that. And I would like to thank all the panelists and all the delegates for your contribution. And it was really insightful. Perry Kent, you did well. Being one person in the panel and responding to all these questions is not that easy. And we are very sorry because we lost like 2 panelists due to technical problem. But that did not stop us. And we really appreciate the discussion that we've had. So it's not like we echo in our first point. It's not a matter of coming and speaking or dialoguing, but we all need to take responsibility. Everything that we do needs to be included. We really need to have a voice, and we really need to, the youth needs to be involved fully so that everything which is tailor-made towards their health can be of impact. Because if you get their opinion, then you'll be able to fit their needs. If you don't get their opinion, then you'll be able to run alone and having millions of the youth behind. So ladies and gentlemen, at that point, we'll end this session. And we'd like you to have around 5 minutes break, grab a cup of water, come back, and let's engage on a very, very critical session, which is touching on the reproductive health and mental wellness. These two goes hand in hand, and you'll see how they correlate and how when we involve like-minded institutions in both sectors, we'll be able to achieve a robust towards building sustainable development. So at this point, please, ladies and gentlemen, just take a break of 5 minutes and let's come back. And we'd like to thank all our partners and all speakers from various institutions that have set their time to come and deliberate on this critical discussion. Thank you and enjoy the rest of your day.
Yes, ladies and gentlemen, once more, good morning. I hope you are able to see me and hear me clearly. I hope somebody has grabbed a cup of coffee, somebody has grabbed a glass of water, and somebody has at least replenished all that was lost so that we are able to take the next step going forward. At this moment, I just want to bring to our attention the topic or the theme number 8. If you can be able to watch from our screens, promoting adolescents, youth sexual reproductive health and mental wellness in Africa. It's equally a timely discussion we are going to have this morning and early afternoon, so that we are able to see the best we can come up with from this session. Without wasting a lot of time, I want to welcome on board the moderator of the session. She had already come with us, that is myriad Tororei. Maria, if you're around, please take it over from me. I can be able to see you, thank you. Take it over from me. Introduce yourself, tell us a bit of yourself. Then after that, you introduce the panelists who are already here. Maria, the floor is yours.
Okay, thank you very much, and welcome everybody to this virtual conference. I believe that we are all eager to learn, share, and do better for our adolescents and youth in terms of sexual and reproductive health and rights, as well as mental health. I believe it's going to be a very interesting sessions that will build up on the ones that have come before. And I welcome you all to this session. Feel comfortable, feel eager, and be ready to participate. So my name is Maria Torore, as you have heard, from an organization called Faith to Action Network. It's a global interfaith organization that works in the thematic areas of family health and well-being, including SRHR, women's rights and gender justice, and peace building. So Faith to Action Network has implemented lots of SRHR projects in Eastern and Southern Africa, and we appreciate our donors, FCDO, GIZ, and the European Union. And so we have lots of experience also in terms of sexual and reproductive health and rights, as well as mental health. And I can say one of the people that we work with, or one of our partners, will also be among the speakers in this session. So you'll get to know more about what we also do. So if I may just share some of the approaches we use in ASRHR. There's the increasing access to SRHR services and commodities, so we should not forget commodities, ensuring supportive policies, multi-stakeholder partnerships, and being an interfaith organization, we also promote use of faith-based approaches. We no longer see the faith actors as opposition to sexual and reproductive health, but we consider faith actors as allies. And so moving on to the purpose of this session, I would like to just introduce the speakers who will be speaking in this session briefly, but they will introduce themselves more. So we have a GBV services expert, Roslyn Mukabana. I believe she's present, and you can see their faces on the screen. We will have a reproductive and maternal health expert, Esther Kiambati, neonatal and child health expert, Gadhura Njeri, Leshan Kereto, a UNFPA and AU Youth Reference Committee representative, and then the executive director of IANASO, Mlewa Kalama. So to all the speakers, feel welcome. And without much ado, maybe I'll also just introduce what the session is about. So it aims to address the critical intersection of adolescent and youth SRH, as well as mental wellness in Africa. It recognizes the importance of comprehensive and holistic approaches to promote healthy development and well-being among young people. So the session will explore strategies, interventions, partnerships that can effectively provide SRH education, access to services, mental wellness support for adolescents and youth in Africa. And I will go straight ahead to our first speaker, and that is Roslyn Mukabana. Roslyn Mukabana, I believe you're with us. Maybe you can just say hi.
Sorry, Maria.
Yes.
Roslyn is having some technical issues. Let's go to Leshan and then we go to the next Kalama.
Okay. I welcome you, Leshan. Kindly introduce yourself, and then maybe you will just share with us about how partnerships between government, nonprofit organizations, and private sector can be strengthened to support sustainable adolescent and youth SRH programs and also prioritize mental health support. So welcome, Leshan.
All right, thank you. Thank you so much. Please confirm if you can hear me.
I can hear you, thank you.
All right, thank you so much. My name is Leshan Kereto. I am a youth champion. I serve as a chairperson of the United Nations Populations Fund Youth Advisory Panel. Alongside that, I have founded an organization called Tareto Africa, which is an organization in Narok County that seeks to redesign social norms to respect girls and women and advocate for sexual and reproductive health for young people. And so I'm very delighted to be here. Also, a lot of what you're discussing also resonates with my work at the African Union, with the different committees where we seek to end global inequalities on young people, and mental health is one of them. I'm excited to be part of this conversation, and I would like to dive into how best can we leverage on partnerships. I think partnership is a very, very important component of all that we do, because even as you look at the Sustainable Development Goals, is that the United Nations realized that even after enlisting the priorities and enlisting the needs and the goals that we want to reach when it comes to the SDGs, realized that the most important SDG is partnership for goals. That is SDG number 17. They realized that there was no way that they are going to achieve the SDGs without partnership. So partnerships is a priority when it comes to what we're trying to do, especially with government, with CSOs, with youth-led organizations, with grassroots community-based organizations, with private sector, and even other diverse grounds that have not been mentioned. And so I seek to, and I've always worked on this because partnership is very, very important. And I have been the lead of partnerships and resource mobilization at the Global Youth Consortium against FGM, where we worked as young people to establish the largest global front or global organization that is working on FGM. And I had a one-on-one touch on what exactly partnerships can mean. Partnerships can, drive organizations to the next level. It can provide for avenues for people to enjoy what they're doing, can provide them an opportunity to grow, to become better, and also to grow into even achieve the goals that they are looking into. I believe that partnership is very important because one, we want to look into successful partnership, having a multi-sectoral approach where all sectors are represented and all sectors have an equal opportunity to serve and to do what they do best, not by doing what is out of their thematic areas, but to just amplify what they're doing, but with consultation and with reference to what is all other people are doing as well. So that provides us an opportunity to serve the people we are serving in a holistic way. And it also hinders competition, it hinders duplication, it hinders unnecessary competition that is detrimental to the goal that we're working to. So I believe that a multi-sectoral approach that is inclusive and also diverse and includes marginalized communities, it includes girls and women, it includes the far-fetched communities, it includes government, it includes UN, it includes CSOs, private sectors, people in the business, and even other avenues that have never been explored. And I think the beauty of our partnerships is that there is unity in diversity. So I believe more, inclusive and diverse ways will provide a very, very organized and established multi-sectoral approach that will even allow us to approach government at the highest levels to show that we are organized and there are priorities that we want to put across. The priority today that we're talking about is mental health, which is very, very important for young people, especially across Africa. And I think now the best thing after that will be to look into generation of evidence. The only way we can be able to be listened to and our priorities met is if we have them documented and we tell our own stories. And we are not talking about very complicated research papers. We are talking about articles, we are talking about publications, we are talking about interviews, we're talking about stories, we're talking about newsletters. At least we generate evidence and we tell our stories. And that now brings us into knowledge sharing. We must share knowledge. We must say what we are experiencing in grassroots. I've been all over the country and even outside the country in many African countries doing my advocacy. As a part of a multisectoral approach body, I'm able to have an opportunity to share my experiences in different communities, be it in Uganda, be it in Senegal, be it in South Africa, be it in Egypt, be it here in Marsabit or Nakuru or Turkana. I can share my experiences and other people can learn and even look into areas of collaboration that they can look into. And so if my experience has been on mental health, we can see the intersectionality that what brings into other fields. So evidence translation and simplification of information to best fit even the grassroots communities so they understand. We ask for translation and the simplification of complicated data to allow for people to prioritize what we are talking about. Mental health will never be prioritized if we do not have evidence. It's about time we now look into evidence-based advocacy that is advised by data, and we can track progress from where we are and where we want to go. Also, I think a multi-sectoral approach provides us an opportunity to even learn from what are the best practices other people are doing towards the advocacy, and how can we learn from them, and how can we better our work, even though in another field, to allow us to even create that was trained by AMREF on advocacy and activism. And that was a game changer for me, because the big approach that we've always had is bashing people. When we want to we are not doing work, speak your start with activism, then advocacy fails and we cannot achieve the goal. But when advocacy fails, that is when we come into activism. And activism has more stringent measures. That is where you can do protests, where you can do boycotts. But before that, always try to have a conversation, prioritize what you want, talk about what has brought you. That way people can even see you